So the following data will be data for the 12-month period ending in the second quarter of 2014. And as Sue mentioned, Kelly Mitchell prepared the STI and bloodborne virus slides. So we start, as we usually do, by looking at notifications for diseases where we have the most number of cases. And you can see here that the chlamydia and gonorrhea notifications, even though they were both high in comparison to the 5-year mean, numbers were stable compared to the previous 12-month period. As for unspecified hepatitis B and hepatitis C notifications, these numbers were relatively stable both in comparison to the previous 5-year average and the previous 12-month period. If we look now at the notifications for diseases where we have a smaller number of cases, notifications for infectious syphilis were slightly lower compared to the 5-year average, but there was a small increase compared to the previous 12-month period. Newly acquired hepatitis B notifications were higher compared to the previous average, but were stable compared to the previous 12-month period, while newly acquired hepatitis C notifications were high both in comparison to the previous 5-year average and the previous 12-month period. Kelly did note that most of the increases were among prisoners, and most of these notifications were among non-Aboriginal people. If we look now at testing data, we'll start by looking at testing for the STIs. And the chlamydia testing rates, particularly over the last 3 periods, has increased, particularly again in the last 12 months. Over that same time, the positivity rate for chlamydia has decreased, thus suggesting a possible decrease in the actual incidence and or prevalence of chlamydia in WA in the last 2 to 3 periods. The gonorrhea testing rate has increased over the last 5 periods. Again, there was a notable increase in the last 12 months. Over that same time, the positivity rate has fluctuated, but in the last 2 periods, we did see the positivity rate for gonorrhea decline. So again, suggesting a possible decrease in the actual incidence and or prevalence of gonorrhea. On the other hand, syphilis testing rates also increased, particularly in the last 2 periods. This is likely due to the introduction of infectious syphilis screening at the Christmas Island Immigration Detention Centre. And over that same period, the positivity rate for infectious syphilis actually fluctuated. Now, if we look at testing rates for hepatitis B and C, the testing trends for both infections somewhat mirrored each other. So for both infections, between 2009-2010 and the 2011-2012 period, we did see the testing rate remain stable, but the testing rate notably increased in the last 2 years. We did see initially in 2012-2013 an increase in the positivity rate, but that rate notably decreased in the last 12 months. We're still trying to identify what might have led to that decrease, but we'll have to analyse the testing data in a bit more detail to dig that out a bit. If we look at overall STI and bloodborne virus testing and notifications by sex and age group, the chart on the left-hand side pretty much shows that the highest proportion of STI tests were among females aged over 25 years, while the highest proportion of notifications for STIs were among females in the 15 to 24 age group. Males in the 15 to 24 age group still made up only 10% of all those tested, and these trends were quite consistent over the last 5 reporting periods. As for the bloodborne viruses, again, females aged over 25 years continue to make up the highest proportion of testing for bloodborne viruses, but the majority of notifications were among males aged over 25 years. Now to the HIV data. In the last 12-month period, there were 126 new cases of HIV, and this was a 14% increase compared to the previous 12-month period. If we look at the notification rate by sex, the crude HIV notification rate for HIV among males increased from about 7 cases per 100,000 in 2009-2010 to around 8 cases per 100,000 in the last period. In contrast though, the notification rate among females decreased in the last 2 periods from about 3 cases per 100,000 to just under 2 cases per 100,000 in the last reporting period. Looking now at notifications by exposure category, you can see quite clearly that the recent increase was mainly driven by an increase in notifications among men who have sex with men, where there were 67 new diagnoses or new cases in the last 12 months, and that was a 34% increase compared to the previous 12-month period. In contrast, males with heterosexual exposure to HIV remains relatively stable, and females with heterosexual exposure to HIV actually decreased in the last two periods. So looking at the MSM HIV notifications in a bit more detail, these continue to be men who acquired HIV within Australia, and this group contributed most to the increase. We did have about 12 cases among overseas born and acquired men, but these were mainly men who had known they had HIV, had previously been diagnosed overseas and just transferred care to Western Australia. If you look at the newly acquired HIV and CD4 count among the new HIV diagnoses among MSM, you can see that even though we have seen an increase among HIV among gay men, we've also seen an increase in the proportion of these men who had evidence of a newly acquired infection within the last 12 months. That increased from just under 20% in 09-10 to just under 30% in 2013-2014. And corresponding with that increase, we've seen the proportion of cases with a CD4 count below 350 decrease from about 40 cases in the 09-10 period to around 20% of cases in the most recent reporting period. So even though we've seen an increase in notifications among men who have sex with men, the findings do suggest that these men are being diagnosed a lot earlier than they did compared to recent periods. If we look at the same data for males reporting heterosexual exposure, these continue to be males who acquired HIV overseas. We did see a decrease in the number of Australian-born heterosexual men acquiring HIV overseas, which decreased from 14 to 8 cases in the most recent period. Similarly, among females reporting heterosexual exposure, these continue to be females who were born overseas who acquired HIV overseas. But in the most two recent periods, we've seen a decrease across all birth and acquisition categories for females. So just to finish off, we'll look at HIV testing data. So the testing data for females, the testing rate for females, even though it's been relatively stable for most recent periods, in the last 12-month period, we did see a notable increase in the testing rate among females. As for the positivity rate decreased in the last two periods. So again, this suggests that there may be an actual decrease in incidence and or prevalence of HIV among females in WA. The male HIV testing rates has increased over the last 5 periods, particularly in the last 12 months. Over that period, though, the positivity rate has remained relatively stable. So this suggests that this recent increase we have seen in male HIV diagnoses may possibly be due to an increase in the testing rate among males in Western Australia. That concludes the EPI presentation. We have time for a few questions here. Any questions?